I'm pleased today to have Jay Fritz, a program manager for the Office of Personnel Management, who helps with the federal employee health benefits, which cover 8 million, more than 8 million individuals, federal government employees, and their dependents, and has almost 200 plans to choose from. So Jay is going to help us think through talk about the different options that are available and how to think through the best coverage for cancer patients and cancer survivors who are covered under the federal health employee benefits. Thank you so much for joining us. Can you just talk a little bit about kind of the range of plans that that the federal government offers, and then the process for choosing plans?
Sure. So for 2025, because we've already kind of switched over to 2025 since we're getting ready for our annual open season coming up. So for 2025, we have 42 different carriers in the FEHB program, and they're offering 64 plans. So what we mean by plans is kind of the benefits, the benefit packages that OPM has purchased for the federal employees and annuitants. And out of those 64 plans, we have 130 plan options, like, for instance, Blue Cross and Blue Shield. They have a standard option, they have a basic option, a Blue Focus option. So that's how we come up with our counts. Where a lot of our carriers are nationwide. We have about 17 nationwide carriers. And these are our fee-for-service plans, which means any federal employer annuitant eligible for FEHB anywhere in the world can enroll in one of these nationwide fee-for-service plans. Then we have our regional HMOs, and these are available to individuals in certain states depending on where the plan operates. For instance, here in Maryland, we have like Kaiser Mid-Atlantic, we have Care First, and other HMOs. So we do give a wide variety of plans. And that's one of the things we've always kind of focused on in FEHB is the wider range of choice that we have in plans and plan options. So it gives people a lot of choice. It also gives them a lot to think about. So, yeah, we try to, cover as many things as what we can for the individuals.
Can you talk about the resources available to help people understand and compare plans and know what the different options available to them are?
Sure. It's interesting you mentioned compare because we have our plan comparison tool. And we always promote our materials. And, I always do the plug for the website. All the information on the FHB program is available on the OPM website, which is www.opm.gov. And if you get on that web page, there's a drop-down menu for healthcare, and that brings up our web page. And then all of our information on the program is on that page, including one that says plan information. We also have a link to our plan comparison tool. So the good thing about our plan comparison tool is that you can basically compare plans. So you enter your zip code, and that'll bring up all the plans available to you where you live. Actually, even the nationwide plans and also the regional HMOs available where you live. And then on that plan comparison tool, we have just general benefit information. Once you put in your zip code, it'll ask you some other questions. Brings up the general information. General benefit information will be up there, and also, again, the plans available to you in your state. One of the other things it also does is link to the FHB plan brochures. And the brochures is what we always emphasize people take a look at, because that's the contractual benefits negotiated between the individual carrier and OPM representing the federal government. And that is where you get into the real details of what is available to you when you enroll in that plan or that option.
Great. And so what about prescription drug coverage? Does the plan comparison help you look at what plans cover as far as prescription drugs?
If I recall correctly, it has some basic prescription drug information, but that is a very involved area when it comes to different tiers and things like that, and how the plans pay based on tiers. So it has some basic basic prescription drug information, and again, kind of focus. This is like basic information to give you an idea of what the plan is going to cover. Again, we can't emphasize enough, especially in situations that we're talking about. Individuals really need to go into those brochures and take a look, because it is very detailed, the benefits that are provided under the plans in FEHB program, including prescription drugs. The other thing kind of good about the brochures are standardized. So all the benefits are under Section 5. So it's not like the HMO brochures look like this, the fee-for-service brochures look like that. They all have the same basic structure. It makes it a lot easier for individuals to go in there and take a look. And even within Section 5, it's broken out by specific sections. And you mentioned prescription drugs. So, yeah, we do have a section, I believe, for it's 5 F is in Frank, which specifically gets down to the prescription drugs available under that plan and that plan option.
Great. And so what about understanding network of providers? So for cancer patients, knowing that their cancer center is in network, or their oncologist or whatever care provider they need is on their care team is in network, is really important. How do you make sure that your providers are covered? And then how likely is it to change year over year? So if you're in a plan and your providers are covered, how do you know that they'll be covered again the next year?
So our plan comparison tool on our website has links to plan provider directories, and we always encourage people to take a look. And that's not exclusive, obviously, to cancer patients, because we encourage everyone to go in and take a look at your providers and make sure they're still part of the network. Really cannot encourage enough people stay within the network for your plans. And we do make the information available. How often it changes, it probably changes more often than we probably would like. So we always encourage individuals, again, to go in there and take a look, because there's no guarantee that that doctor that's in your network today is going to be in there the next week or so, or a month or a year later. So we always, again, encourage people to take a look. And again, that's my situation too. I'm not a cancer survivor, but again, we always encourage, because everyone likes their doctor and they want to stay with their doctor if possible.
Mm-hmm. Yes. So in addition to the website and the plan comparison, are there other resources to help people if they're really not sure how to navigate these? Because it is a lot of sort of digging into the details of a health insurance plan that not everybody really understands or is familiar with. So are there other resources that can help people if they have questions or need help kind of really making those comparisons?
So I think probably one of the other resources that we hear a lot about is called Consumer Checkbook. And I know the Consumer Checkbook has a lot of information. I've never used it myself, but I believe if you put information about yourself, Checkbook will make some recommendations. I know a lot of our agencies subscribe to Checkbook for their employees. The employees seem to like it. And we're kind of agnostic at OPM. All of our plans are good plans. It's just which is the best one for you. So we don't really make recommendations, but I think Checkbook has a little more leniency in doing that and making some recommendations. But again, from our perspective, again, we can't emphasize enough, look at the brochures, because that is going to tell you what your plan provides and help you realize or make a decision as to whether that's the best plan for you.
Can you tell us about the open season for choosing plans?
Yeah, one of the good things about the FHB program is that we have an annual federal benefits open season that allows you to go in and actually make a change if the plan that's currently you're enrolled in isn't necessarily the best one for you. That we've spent some time talking about all the different plan comparison tools and how the plans differ, and to look at brochures. So our annual open season is coming up. It runs from Monday, November the 11th through Monday, December 9th of this year. And that gives you the ability to go in, do the analysis, and also look at the changes for 2025. Right now, we're still in 2024. So this gives people the opportunity to see if there's any benefit changes for 2025, and also to see what their premiums are going to be for 2025. Now, the information isn't out on our website yet. That'll come hopefully usually about the first week of November, that people can start taking a look at it. We're still, finishing up verifying data, et cetera, et cetera. But we do emphasize the open season, and we have a special website for open season, which is opm.gov/open season. And we put a lot of effort into that page. We go ahead and put a lot of information in there, the plans for 2025, also the rates for 2025, the brochures, link to plan websites, provider directories, as we talked about earlier. All those things are on that open season website. And we always encourage people to take advantage of open season, because changing situations, changing premiums, changing benefits, it's an opportunity that we like to see people take advantage of.
Great, thank you. So I want to ask about prior authorization, which can often be a challenge for cancer patients and can cause delays in getting treatment. Is there any way to know when you're choosing a plan how that plan will handle prior authorization and what types of treatments or services will need prior authorization?
So again, I'm going to take us back to the brochures. We talked about the benefits spelled out in the brochures. The brochures are more than just benefits. It also has information on how the FEHB program operates. It has information on all these other things you're talking about, how plans operate, including prior authorization. So they do vary by plan. Requirements vary by plan. So again, I'm kind of repeating myself, but these are the things that we at OPM put a lot of work into explaining, giving as much information on enrollees as we can for them to make a decision. So prior approval, prior authorization, all this is spelled out within those plan brochures.
Okay, great. Thank you. So just in summary, is there any specific advice you would have for cancer survivors or cancer patients who are currently in treatment, who know they have, significant healthcare needs, to make sure that they're choosing the plan that really works best for them?
So our brochures do not specifically identify cancer as a diagnosis. So that's why we need to go into all those different sections of benefits. Some things they may want to look at is access to treatment facilities, and that's within our section 5 of the brochure. Skilled nursing, all of these benefits are spelled out in extensive detail within each one of the brochures. Home health services, that's addressed. Um, Different coverage levels, you can find them in the brochures. We have index for the different benefits under the brochure. Prescription drugs we talked about earlier. It's really, the information is in there for pretty much every service someone could be interested in finding information about. So again, I do sound like a broken record, but these are extensive documents that get down into the weeds on the different benefits provided by the plan. So that's where individuals need to go, considering what their situation is, what their circumstances are. That's what they need to take a look at.
Great. Thank you very much for your time and for helping us understand what the options are.
Of
We
course,
appreciate it.
anytime.